Good morning and welcome to this local public health forum of the Public Health Museum in Massachusetts. And it's great to welcome you all here at the end of Public Health Week. I think technically tomorrow is the end of Public Health Week. And we have a program if you are interested in doing a campus tour of the Tewksbury Hospital. That's tomorrow. I think you can still register. Today we have a local public health forum consisting of public health nurses. The In the past we've done these forums with a variety on topics. Today we're going to specifically talk about the role of the public health nurse and how it is in 2026. I ask everybody to keep their uh, microphones on mute. You can put questions into the chat during. We should have time for a more open discussion at the end. And without further ado, I'm going to turn it over to Professor Harold Cox, who's professor of the practice of public health at the BU School of Public Health and moderator extraordinaire, and has moderated most of these public health forums over the years. And I'm going to remind the panel that I muted everybody to begin with. So if you thought you were on mute, you're muted now. So that's something to note. And I am going to take myself out of here and listen to this wonderful panel.
Good morning, everybody, and thank you very much, Al. I'm Harold Cox, and I'm very glad to be here with you today. Our conversation today is about how nursing, how public health nursing in particular, has shifted and changed. We know that all of our work changes when there are new things that happen. And clearly, the pandemic was a major challenge and a major concern that changed the way we do things. So we want to get a sense then of how has public health nursing changed, as well as what are some of the positives and maybe even some of the challenges that we experience in the discipline at this particular time? I'm very fortunate to have seven of our colleagues from across the state representing many different sizes of community to be part of our conversation. The ways this is going to work is that we are going to have a conversation among ourselves, and we also have a couple of polling questions where we will engage you. And then later into the conversation, we'll see if there's an opportunity to hear some of the concerns that you have as well. I want to start by asking our panelists to identify who they are. So tell us your name, tell us how long you've been doing public health nursing, which community you're in, and would you tell us one aspect of public health? Because it dawns on me that everybody may not know exactly. So what are we talking about when we say a public health nurse? So help us to understand what that is. And to assist, I'll just call off your names. Amelia, you're at the top of my list of my screen. So would you start, please?
Good morning, everyone. So my name is Amelia D. Domenico Houghton, and here it's Houghton for short. I have been a public health nurse. This March was 8 years. I have been here with the city of Worcester. This whole time, I've had two role changes. I am now the chief public health nurse for the city, and I have a team of 3 other public health nurses under me. One thing that we have a heavy focus on is communicable disease case investigation, especially TB-related cases. That's just one part, but it's a time-consuming part.
Thank you very much, Amelia. Meg, you're next.
Good morning. My name is Meg Ryan. I am a public health nurse in Franklin County, and I am part of a cooperative public health district at the Franklin Regional Council of Governments, We serve 15 of the smallest communities in the town, places like Ashfield and Bernardston and Shelburne Falls. Most people have heard of Shelburne Falls at least, which is two towns, Buckland and Shelburne. Northfield, Row, Monroe, many others. It's an interesting area because many of the towns are very small. I've been a public health nurse since August of 2021. During my interview process, I was assured that COVID was just about over and we were going to have a reset moment and turn our attention to the many other things that public health can serve. I'm going to highlight one of the unusual things I do, just to kind of highlight that the task of preventing, promoting, and protecting public health can be very wide ranging. As part of my job, I am a certified SHINE counselor, which is serving the health insurance needs of everyone, which means I can counsel people on Medicare options. It's a very intense process. It's a very lengthy um, um, training, and the recertification is required. But it's really essential because the health insurance is very confusing. It not having the information you need can be a huge barrier to actually accessing all kinds of different medical care. And it's incredibly satisfying work because the people I work with are generally very grateful. If you want to feel really good about yourself, just become a Medicare counselor. People are going to love you.
Thank you, Meg. And it'll be really interesting to hear how things did not change for you as you began your job. Fiona, you're next.
Hi, everyone. My name is Fiona Coach. I am a public health nurse, a regional public health nurse in Holyoke, Chicopee, and South Hadley. We are also part of a regional collaborative called the Central Pioneer Valley Public Health District. And I work in three very different communities. I've been a public health nurse for 2 years in this role. And something that I do as a part of my daily work is I create public health communications on monthly health topics that go out in the community. And I also create and deliver educational presentations in the community at places like our senior centers.
Thank you very much, Fiona. Jenny.
Hi, everyone, I'm Jenny. I'm the public health nurse for the town of Needham. We are part of a shared services agreement called the Charles River Public Health District, which consists of Needham, Medfield, Dover, and Sherborne. I've been a public health nurse with Needham for over 3 years now. I started actually a graduate program, so I actually have 6 months of a practicum experience in Medfield. So it kind of worked out for me. Um, and one thing that really consists a lot of my role in Needham is giving vaccines to underinsured or uninsured, and also newly arrived children in particular. Um, I will go to their homes if they don't have transportation. I will also meet them at the schools if I have parents' permission to give them vaccines, since we do have a full VFC program in place.
Thank you very much. Kelly.
Hi, everyone. Thank you so much for being here today. My name is Kelly. I'm the public health nurse for the city of Newton. I've been in this particular position now for about a year and a half. Newton is also part of a shared services agreement. So I often collaborate with Brookline, Belmont, and Arlington. Us nurses do a lot of work on our towns together. One thing that I did want to highlight, because it's a little bit different, that we do is recreational summer camp inspections, permitting, and licensing. So a little bit of a different ideas enforcement that some of the public health nurses are doing in order to keep children safe throughout the summertime.
Thank you very much. Shuang.
Hi, good morning, everyone. My name is Shuang Shen. I work for Watertown as a public health nurse for about 4 years now. And a program that I'm running in Watertown is CPR and the first aid training. So I have some classes every month and teach the residents how to use first aid skills when they need, and we teach CPR for different populations, including adults, children, and infant. Because one of public health nurse role is to be prepared for emergency, and this program helped the residents to fill the gaps when after they called 911. Between the time the 911 coming, they should learn from something from the program what they can do to help whoever needs.
Thank you very much. Jill.
Hi, everybody. My name is Jill Sweet. I am the public health nurse for the Southern Berkshire Public Health Collaborative. I've been almost 5 years in this position. We cover the towns of Alford, Great Barrington, Lee, Lenox, Monterey, Mount Washington, New Marlboro, Otis, Sandusfield, Sheffield, Stockbridge, and Tyringham. Our smallest town is Mount Washington with less than 150 people. In Great Barrington, I think there's probably over 7,000 residents and numerous second homeowners. So when I first started this job in 2021, it was in the midst of COVID and, case investigation. So that was, 8 hours out of my day. So things finally settled down. I did become a certified child passenger safety technician. So I have a car seat program. I've distributed hundreds of car seats throughout Berkshire County. When I first became a car seat technician, I was pretty much the only one in Berkshire County that provided this. So I go from anywhere from Sheffield to North Adams, so all of Berkshire County. Since then, I think there's been 5 or 6 other not only public health nurses, but community health workers in the area that have become technicians and have applied for the grant program through the state to get car seats to be able to offer these to those in need. So yeah, that's my great accomplishment in this job that I am very, very proud of, and just recently got awarded again the car seat program.
Congratulations to you for that.
Thank you.
What's impressive to me is the wide variety of activities that you're doing. Everything from being a car seat technician to doing the shine work to doing the communicable disease activities, any number of things that you've got going on. It is a very impressive array of things that you're doing. And many of you came in during the pandemic, a couple of you right before the pandemic, but I'm wondering how your work may have shifted from the time that you came here to the time that you're now, at whatever point it was that you came. Some have only been here for a year and a half, others for as long as 8 years. How have things shifted, or maybe they've stayed the same? What's different?
I can start with this. So when I came to Needham, we had the Abbott machine. I don't know if anybody else remembers this for the antigen testing for COVID. We had gotten a grant from the Metro West Health Foundation to acquire the antigen test. And so when I first started, we had people that would sign up and fill up our slots, and we would have per diems come in and test people out for COVID, go out to their cars and test them. And then this just started to dwindle down to the point where now we don't even have that machine in use anymore. And we ordered the home testing because that's what people wanted. And now we have like crickets, like nobody's coming in anymore because we've done so much education now. And now the CDC is like, just treat it like every other upper respiratory illness. And so that was kind of a shock for me, that it was just like the decline just went so fast through the summer when I first started. So I think people have started now to, self triage a little bit and not seek out as much care as they used to, which is a big change from where I came from before.
Yeah, it's interesting about the fact that people were so engaged. Everybody wanted to get tested. They wanted, and how that has actually shifted just because as our mindset has begun to shift. What else? What else has changed for any of you?
Well, I'll actually echo a lot of that. That when I started in August of 2021, it was all about COVID contact tracing, COVID, and huge controversies about mask mandates in schools, mask mandates here and there. We found that very quickly we needed to change from mandates to recommendations. It was just politically much better. And a huge demand for home tests. You know, we spent a lot of time distributing home tests to our boards of health, to schools, to other public places that need them. And it slowly shifted to, you know, now it's just a wide range of all kinds of different topics. I'm right now really focused on education about tick bite prevention. And that's a really nice change. You know, you can uh, look at any number of different topics now. And disease surveillance is just a piece of the job now.
Meg, could you say a little bit more about the switch from calling it mandates to calling it recommendations? That's actually a major shift in the way that we actually communicate with people. Would you talk a little bit about, so how did you actually decide to use that kind of terminology and what happened as a result of that?
Well, the mandates just got a lot of pushback eventually. People were angry that the government was telling them how they should live. And, you know, perhaps rightly so. This was in, you know, well past the time we had vaccines. We still need to protect each other, but changing it from a mandate to a strong recommendation made it clear that it was an advisable thing to do, and yet also made it clear that people still had their individual rights, which is very important, you know, especially, dare I say this, in a rural area where a lot of people are very independent. Um, so it was a good thing to do. It made it more palatable for a lot of people. And I think being mindful that people all want their self-agency. And yet we need to not just let go of what's important to do for taking care of each other.
Yeah.
So
Amelia, one of the things that you identify that you've been in your position for 8 years, so you were here before the pandemic occurred. Could you talk a little bit about how things may have shifted for you as you went into the pandemic and as we're coming out of the pandemic?
So that's a
And
very,
Amelia, I'm going to ask you if you'll move a little closer to your mic, please.
oh, is this better?
Yes, that's better. Thank
Oh,
you.
okay. Um, yes, very important question because I have seen a shift. So before the pandemic, we were just doing our work. We were doing our normal contact tracing, case investigation, outreach work, education, whatever it was. During the pandemic, the community expectations started to shift and more was expected. The community understood what public health was and that public health nurses existed. So they may not have had that awareness before the pandemic. Now they're fully aware that we exist. The expectations have changed and in several ways. So public health nurses today are seen more as leaders. We're not just care providers anymore. More is expected. Um, we're expected to be more responsive and equity focused and knowledgeable in all the public health disciplines. And you can see that in education and how that shifts towards the changing communities and the changing environment and the changing client. And we're more proactive in building the trust, the infrastructure. So it's been a shift. It's been a major shift.
Yeah, it's amazing how the work has actually changed before, during, after. Jill, you came in, it seems maybe right at the time that it was happening, or maybe right before.
Um, there was still like kids had to stay home from school. You know, everybody, if you had COVID, you had to stay home for what was it, 7 days, 10 days? I don't remember. That was like eons ago. Um, yeah. And I have to say, following what Amelia said, when I call people now, if they have a foodborne illness, they're like, they had no idea that there was a public health nurse in their town. And then after explaining, how did you get my information? And, explain to them, and they're like, thank you for all that you're doing. and keeping us safe. So that's nice. That's, a nice shift. And then you do have those people, I don't understand why you're calling me, type of thing. But um, I'm glad that we're out of the day of, oh, you have to stay home and your kids have to miss school. If the parents test positive, and then the kids have to stay home, and then the kids are missing 3 weeks of school because just the way the trickle down effect of everybody in the home and when they got sick, that was really, really hard with that aspect. Because I went from school nursing when the pandemic hit and everybody coming to my office, when are they going to close school? When are they going to I'm like, I don't know when they're going to close school. We're here. We're, just do what we need to do, stay safe. Um, to then having to call people. It was a very interesting time. Um, yeah.
Yeah, thank you very much. Kelly, you said that you've been with us for about a year and a half. Is that right? All
Correct.
right.
Yeah.
So you are one of the newer nurses that has actually come into the field. I'm wondering, have things shifted? Have things stayed the same? Have you benefited from the things that the others have had to do over the last number of years?
Yeah, it's interesting because in some ways I feel like we look at COVID as, oh, that was so long ago, and I guess 6 years is somewhat long ago, but even since I've started, a lot of my focus in my job has really been bringing back a lot of the programming and stuff that not necessarily were lost, but things that we've now had to rebuild. Just getting out in the community more and catching up children on vaccines. When COVID hit, it was, don't worry about kids can't get to their physicals, so don't worry about getting them all up to date on their vaccines right now. We got to worry about COVID, we got to worry about this. And then for some families that, still have existing barriers, they're still catching up on stuff like that. So I would say we're still, even 6 years later, dealing with some of that. And then, yeah, trying to get out in the community and do more of our preventative education that to certain groups of people that have kind of been missed since the pandemic has been huge.
What's really interesting is how things have, well, I mean, public health nurses have such a broad responsibility, but how you are now able to do some things that you may not have had time to do before, or the expectations have changed. When I was thinking about this presentation, I was thinking about when 9/11 happened and when we dealt with the anthrax attacks. So in my former life, I used to be the public health director for the city of Cambridge for about 10 years. And so I was there when we did anthrax and there when 9/11 happened. Prior to 9/11, emergency preparedness didn't exist. Yes, we considered them fringe. The people who were interested in thinking about emergency preparedness were kind of a fringe element. And people would used to say, who are those people? What are they thinking about? And then suddenly 9/11 happened. Suddenly the anthrax attacks happened and emergency preparedness became a thing. And it shifted majorly the way that we thought about our work and the way that we did our work. And I'm wondering if you can talk about shifts that may actually have occurred. I think Amelia began to talk about the fact that you are now expected to be a leader as opposed to just the person who gives the shot. Could you talk a little bit more about what the expectations are of your municipalities and of the people who are in your communities?
I can speak a little bit on that particular concept, especially with vaccine hesitancy. I think the public looks to us and has always looked to nurses in particular as a trusting source of information. So they look to us, especially when there's murky waters about, do I get the COVID vaccine? Is it recommended for me? Why are some people saying it's not? And why are some people saying it is? And so we've really had to step into this role of information that's coming from a reliable source, but approaching it in a very tactful way. We can't tell people just statistics anymore. We have to validate their concerns, understand why they're having these questions before we even start having conversations with them about, why we recommend certain vaccines, just because they've heard so many different things out in the media and even between friends and family.
Yeah, it's a really interesting to think about how we have to communicate differently. Shuang, I'm wondering what your experience has been as you think about this matter of what either the expectations of your community are, or in particular how you deal with the issue of vaccine hesitancy for individuals who need to get vaccines.
Yes, we we kind of have multiple access to the vaccines. So instead of our public vaccine clinics, we host some specific for seniors, and we do homebound vaccines going to whoever has disability. Going to their home and make sure they have been vaccinated. We also work with housing authorities to go on site to give the vaccines. So we kind of open to the public and do our best to meet their needs. We get phone calls like we will assess what's the particular needs. And also we have different vaccines, different type of vaccines available. For example, we have someone called in last year who's allergic to eggs, so we make sure we have those vaccines that can give to the people who cannot have eggs.
So one of the interesting things that's happening in the world right now, things continue to shift. So we have now a new Secretary of Health and Human Services who is probably the most anti-public health person that we've had in a long time. And I'm wondering how that may have actually shifted in what you are hearing from people right now. Are they confused? Are they paying attention to it? Are they thinking about it? When the secretary makes one of his pronouncements, what do you hear from the people in your communities?
Um, I do like vaccine tabling. Sometimes I'll go to community events and I'll bring information about childhood vaccines. And one of the things that I've heard is parents will come up and then they'll ask questions about things that they've seen online or things that they hear in their social circles. Um, and something I like to do is I provide information from the Children's Hospital of Philadelphia. They have really good printouts that address some of the most common questions, like what about additives in vaccines? Or my child, are they receiving too many vaccines? So I find that when they come to me with a question or they have, something that they're hesitant about, I can have a conversation with them and then I can send them back with something that is exactly what they were asking about. But I do feel like people just are coming up and they just have questions and some of them are just not really sure about what they're hearing and they're confused. And like Kelly said before, I feel like have long been a trusted profession. And so when someone hears public health nurse, I think it gives us another level of trust with the public. So we have an important role in combating misinformation.
Yeah, nurses, just the idea of just saying nurse brings comfort to some people. It scares some other people, but it certainly brings some comfort for some individuals. For me, the idea of nurse meant shots. So it was not one of those things I was terribly excited about. But I'm wondering from others of you, Fiona's mentioned about the confusion that people are expressing. Are others of you seeing that as well, or are you experiencing things differently as people are dealing with the time now and what's happening in particular with what's happening on the news?
I'm definitely seeing more people who, another term for vaccine hesitant is vaccine questioning. More people are questioning whether it's really necessary. I think there's been a lot of doubt sown, unfortunately, in vaccines, which are a proven way to save lives. And I think it's really unfortunate. And I think, to echo the change in how we need to do our job is that we need to be better at communicating, that we need to understand data does not change minds, but stories can. And having a relationship with a trusted person in your life can eventually change your mind. So just being mindful that people have more questions about vaccines, what's in it, both the components, and some people want to know what which viruses are in the flu vaccine this year, which strains are there. So in a lot of ways, I think we as public health nurses need to hold more information than ever before, especially about vaccines.
It's interesting that people are public health sort of came out of the closet, so to speak, when COVID happened. People began to understand some things, or at least hear some things that they had not heard before, like they heard public health. Well, what exactly is public health? They heard things like epidemiology, may not know how to spell it, and may not know exactly what it is, but they people were always talking about the epidemiology and was thinking, do you know what you're talking about? But that's maybe a positive thing for public health. What about others of you? Hesitancy, questioning, confusion? Are you experiencing any of that in your communities?
Yes. So one of the things that my SSA does to kind of piggyback off Fiona, we also do social media campaigns as well and provide educational materials. And this isn't new, but we've always said like vaccines do not cause autism. But when we recently did it in the fall, um, when our current Secretary of HHS said that they do again, or, you know, made some implication that it did, it kind of ruffled a lot of feathers, which I was surprised because before people up here were like, yes, we know that that vaccines don't cause autism. But then, like Meg said, people are starting to question, like, if the director of HHS is saying this, or why are you saying that they don't? Like, do you not trust them? Like, what's happening? You've always credited the CDC and the ACIP, and now you're not. You're going against what they're saying, and we always have to relay it back and say it's science, it's not opinions that we do our work on. Um, and just having open communication with people, I feel like people need to be comfortable coming up to us and saying, hey, why is it that now vaccines are causing autism? It's like, correlation is not causation. It doesn't mean that because you give your child an MMR, they're going to immediately get autism. That's not how this works. So then we have a conversation, and we have an epidemiologist in our town, so we also collaborate with her a lot. And I always say just break down the data so that way I can relay it and make sure that people can understand it. Um, and yeah, I think we always keep in mind, like, we're not aggressive people. I think innately nurses are just like, let's have a conversation. We're nice people. Talk to us. So I think it's nice that people can come and have a conversation, not feel so attacked and be like, we can't tell them that they're wrong. We just have to meet them where they're at and just provide them with info. And at the end of the day, they can make their own educated actions if they want to immunize their child. But our job is just to provide information that can make a difference for somebody.
Jenny, I'm really glad you said that. I've now heard that from a couple of you, the importance of meeting people where they're at, that we have to acknowledge what they are experiencing and then take them hopefully to the next level. But certainly validating where they are at this particular time in their own experience, and then hopefully taking them, if necessary, to another level. So we are fortunate to actually have a couple of polling questions so that we can get a sense then about who the people are in our audience. And Al, I'm going to ask you to put up the first question, which is a question just to give us a sense about who's in the room with us right now. So Al, could you give us some instructions for completing the first polling question?
Yes, so go ahead. Can you see it?
And I cannot.
Okay, hold on. I wonder if people in the audience, can you see it?
So could someone open up their yeah, oh no, the audience cannot see it.
Oh, okay, wait a minute. Because according to my computer, it says it's doing it. Hold on. I see what's happening. Um, Unfortunately, we can't scroll. So the all the questions were in one file, and so you have to do the whole thing at once.
Okay.
But
So we have to do
I,
all of the questions.
I, so- some people are responding. I don't know how that's happening, but
Yeah, I don't see it. But there are others that are seeing it. You're saying you're seeing responses, Al?
yes. Let me.
Let's see what you find as people are okay. So I see a couple of people who are saying that they submitted their questions. We'll give you a couple of seconds, everyone, to complete it for those of you who are able to see the questions.
Yeah, I'm not sure. Uh, we could let, let's stop here. You continue, and I'll try to figure this out.
Okay, thank you. Thank you to our tech guru who is behind the scenes working feverishly to actually
No,
get
I'm
our
the
polling
guru.
questions.
I'm the guru. It explains it, but at least I remember to record.
Al, I'm grateful for what you're doing. It's really important for us. So I'm back to our nurses and this whole matter of what it means to actually communicate in a different kind of way. How has that actually changed the work that you are doing? Because I'm hearing you say we should meet people where they're at. So how has that actually shifted? Has that one shifted anything in the way that you think about your work or that you do your work?
Well, I can respond to that first. So for us, meeting people where they're at means going to them. So more outreach, more mobile clinics, and getting involved in home visits, whether it's to bring a vaccine or whatever the case may be. And during our case investigations, if we have to do home visits, we can use that as an opportunity to also bring vaccine with us and provide education. So for us, it's building that trust when you're in their presence. And when you continue to do that, you have that partnership.
So you're saying that an important part of this about that meeting people where they're at is actually physically being with them.
For us, yes, that's how we see it.
Okay. So what does that mean though, given that everything is switching to being on computers now, and that we have AI responses that are actually answering things as opposed to real people? What does that say about building trust now with people? Can you build trust over the computer in the same way that you can with you when you're actually standing in front of someone?
Well, for some of our communities, um, they don't have access to a computer. They don't use one. And so with people who have access to a telephone, that is where you have to like change what you do, change your approach. And if you want to serve these people and get them what they need, then you can't say, here's a link. It doesn't work for everyone. You have to do a little bit more to help people. And it's just expected that you will pivot the way you need to in this profession. That's what I have found. And you're willing to.
So, it's an interesting thing about this business about computers and how it has shifted the way that we do our work. And Amelia has said that one-on-one, face-to-face becomes critically important. I'm wondering about others of you and the role of tech versus in-person activity and how that has actually shifted the work that you're doing or how it has made you need to think differently.
I'll answer that. When we published our fall clinic season, this past year, we posted our whole clinic schedule in the Shopper's Guide, which is a local newspaper that is mailed to every home in Southern Berkshire County. That was one way to get the word out because not everybody, older people, don't have a computer. Some people don't even have internet access where we are. A lot of people, older people don't have cell phones, don't know how to scan a QR code. And then they get in there and they try to register and they get to the insurance piece and they're like, I don't know, and they give up. So we put in there, you can, sign up on a link, you can call our office and we'll help you register. We've gone to, senior centers during our wellness sessions and offered to pre-register people there for an appointment. So it's just trying to, meet people where they're at. And sometimes it's a technology issue.
So, there was a few years ago, there was this wonderful picture of a little child that was at some museum and they were trying to actually open the picture up wider. It's just, who would have thought? But there was this little kid who was 4 or 5 years old who was actually doing that. And then on the other hand, we have individuals who either don't have access to computers, who don't know how to use computers, and so you now have the responsibility for dealing with both of those populations, for dealing with people who are younger, who are techies, and or at least have access to computers, and older folks who, please call me on the telephone is the response. I must tell you, I have nieces and nephews who don't use the telephone, and I can only talk to them by text unless they want money. If they want money, they suddenly know how to use the telephone, but otherwise, everything is by text, and so I'm wondering how that has actually shifted your world, that you now need to think about both of these populations, which are really very divergent.
I will say too, in general, I think this mirrors something that Amelia was hitting on. We have to be, as public health nurses, or really as any public health professional, very good at being creative and thinking on the spot, willing to be flexible with people. I think for me, at least meeting someone where they're at really means asking them, like, so if this isn't going to work for you, let's brainstorm what might work for you together, because sometimes people, you just need to ask them, maybe for them email is the best way to communicate. Maybe for them, a phone call at 5 o'clock is easier for them to take than a phone call at 10 in the morning. And so in that sense, you have to be able to pivot depending on who you're working with. And in general, anytime I talk to someone who's considering, especially becoming a public health nurse, that's the one thing I always highlight. You have to be flexible. You have to know every day you're going to come in and you're not going to know what's going to happen. And you have to be comfortable with meeting people where they're at and maybe going out of your way in an unexpected way to help that person.
Your work shifts every day.
Sometimes
And
you
so I
never
wonder
know.
say that again,
Yeah,
Kelly.
you never know what you're walking into every day.
Never. Never. I mean, it's one of the wonderful things and one of the complex things about the whole field of public health. There were days when I could just brush everything off my desk and just start all over because something entirely different. What about others of you as you're dealing with this business of this bifurcation in the populations that you deal with? A younger population that is more tech savvy and only wants to talk to you by text, or an older population that is way more comfortable with you actually going and being in front of them.
I actually want to say that I think it's not an either or. I think there's the way we communicate now has changed drastically over the last few decades. That it used to be everyone got their information from the same 3 or 4 sources, the local TV station, the local newspaper, the local radio. And now it's a multiplicity of different social media platforms. Some people still want paper flyers at the library. So one of the ways we have to pivot and be flexible is to try to think of all the potential methods and avenues of communication to get the word out. One of the best ways for some towns is actually the reverse 911 platforms, where some towns will use just to let people know of an event coming up. They don't wait for it to be an emergency. So, definitely there's a range of styles. Some of the towns I serve have only had broadband for 2, 3 years, and there are vast swaths that don't have cell service. So, you have to recognize that for some people, the landline is the only thing that they have as far as a phone goes. So, how creative can you get with all the different ways to try to reach the entire population?
Meg, I need to tell you that when Reverse 911 came out as a new technology, I actually thought, wow, this is the best thing ever. I must tell you, I hate it now. That
Yeah.
the idea of anybody calling my house with yet one more anything is the last thing that I want. Fiona and Jenny, you both indicated that an important part of your work is doing communications. And I'm wondering how do you relate to this business about the differences in the ages of individuals, or the differences in understanding about technology, or the differences in how people receive information?
Yeah, I was actually, when Kelly first answered this question, I was going to say the exact same thing, is that I feel like being adaptable is really like the name of the game. You have to be able to think about like who's the recipient of this message, how can I reach my population? So in the communities that I serve, I do physical health communications that go up on boards that are throughout the towns, so people see them. And also another hard thing about public health is that sometimes you don't really know the impact of the work that you're doing because a lot of it is behind the scenes. And so the first time I heard someone say, "Oh, I like, people are commenting on the signboards, they really love them," made me feel really good because I felt like people were actually receiving the messaging. So, sometimes it's kind of hard to know what the impact of our work is. So we do that, and we've done a variety of different ways to get our communications out. We've done bus advertisements on the PVTA buses. We've done billboards on 90 and 91, and all sorts of things. So you just have to be creative, really, like everybody else is saying, is think about new ways to get information out. Because not, with the rise of technology and social media, that also means you have to have someone to do your social media and keep it up. And we don't really have that. With we're all kind of stretched with the things that we do. So we just take different approaches to get our messaging out. And a lot of that for us is physical messaging that people see out in the community.
Hmm. Yeah, yeah. And Jenny, are there any additional responses that you would have as you think about your communications work?
Yeah, so one of the big things about communicable disease surveillance is reaching out to people to follow up. So I am not shy about sending just a very vague text if I see somebody who is a Gen Zer or even a millennial. I feel like people my age and younger are like, I'm not answering the phone. Like you said, like if it rings, they're not answering, especially lately with a lot of spam calls. I just send like a quick, like, this is who I am, this is where I work. You can verify it on the website. Just need to talk to you. And I usually get a response. They're like, oh, yeah, let's talk later. I'm like, perfect. Because if I just cold call somebody, I never reach them ever. And then I'm in like this vicious cycle of trying to like get in touch with their doctor who ordered their labs. And it's just so much easier if I just vague text and that's it. And same with like what Fiona had said, like a lot of our messaging in regards to like vaccine clinics or any public health messaging, we do create flyers and we'll post them. We'll put them on Facebook and then Instagram. Um, we've also done stuff on local cable because people still watch that. So we've done some work on there. We filmed a few things, especially for our Domestic Violence Action Coalition. They did a full 5-part series on there. And we also have a town newsletter that people get into their emails, and it reaches about 8,000 people in the town. So we managed to advertise there as well. And we tell people to follow the town, follow the public health department, Facebook and Instagram, just so you can get your messaging. But for people that are homebound, we have an idea of who's there because we work with the social workers in town, and we ask them like who is interested in a vaccine or who needs a home visit just to check their blood pressure. Like, can we do something? So a lot of it's also collaboration just to identify people that literally don't have a smartphone, they don't own a laptop, they don't want it. They're still home like a landline and cable TV. So we try our best to reach literally the tech savvy to what the kids call old school.
I teach school, and if anybody says that word old school to me yet again, I don't know. I'm done. But because everything that I think I do is old school. I want to shift gears a little bit. So I'm hearing about all the incredibly wonderful things that you're doing. I'm hearing about all of the um how your work may have actually shifted either before, during, or after our period of as we're dealing with COVID as it is presents right now. I'm wondering what's problematic in the work. Where are the challenges that you have in the work that you do right now? Shwang, you want to start?
Yes, sure. Like Kelly mentioned that we don't know what's the day gonna be when we working every day. So sometimes multitask, I mean community level multitask is what facing like daily. So the challenge would be like a lot of things come at once and you want to prioritize it. For example, you have a TB case, you have somebody need vaccine, you have a permit needs to issue, like those kind of thing come at once. You want to make sure which one is the most need most immediate attention, and then kind of figure the sequence out. So what I do is I like to write it down and then see like, just see which one goes first and then do it in my order. That's a challenge that I think a public health nurse may have.
So multitasking and having the expectation that you're going to have to do everything all at one time becomes a real challenge. What else? What else is a challenge for any of you?
One of my challenges is that the three communities that I serve on our collaborative are really different, and we have a lot of very different issues. And we just don't have enough nurses to do all of the work that we'd like to do. Um, and that's part of the reason why regionalization, like the shift towards regionalization has been really great. Because I've been able to come in and work with the nurses that have already been working in these communities. But even with that, we still have so much work that we want to get done, and there's only so many of us.
So the availability of the workforce, how many people are there? I must tell you, Fiona, it is music to my ears to be able to hear that regionalization works. I need you to know that 20 years ago, 25 years ago, when we first started using that term, you could only say it in the back room with the lights out. Because the idea of talking about anything that might be cross communities or regionalization, I'm grateful to still be alive at this point. So it is music to my ears that people actually believe that there's some benefit 25 years later, but music to my ears. So thank you. Thank you very much for that. What
Yeah.
about
I feel like also too, I came into this role being a regional nurse, so I never knew what it was like before regionalization. So, I feel like it gives me a little bit of a different perspective on things, but I think that it's great.
Al, I think maybe our next presentation should actually be about regionalization before and after. So we will, but well, that's a conversation for a different day. So tell me about others of you. What's challenging for you? So far, we've heard not enough individuals to do the work, as well as needing to multitask and needing to prioritize because of all of the things that are on your plate. What else is a challenge?
So can I go? So couple of things that we can't forget is the multitasking leads to mental health strain and burnout. And especially if the workforce is short. Um, those things just all go together hand in hand. Now, add on top of that, the public health underfunding that we always experience. Um, it's it's a serious situation. The burnout is real. The mental health strain is real. And all of a sudden, work that is so enjoyable um, becomes stressful. So there's
Yeah,
that.
it's a really important point that you make, Amelia, that yes, there is plenty of work to do, but it comes at a cost. That there are downsides to actually having to go in every day and reprioritize your work, to decide what are you not going to do right now, and it's all important, but what are you going to do at this particular time? So thinking about under-resourcing as well as thinking about the mental health cost to the workforce. What are other challenges?
Funding. Make sure
Tell
there's
me some
funding
more
so
about that.
that
Who said that?
Jill.
Jill.
Yeah, so so there is enough nurses, but then how do you compete with nurses that work at the bedside to get them to come over to public health? Who's gonna take a 50, $60,000 a year pay cut to go do public health? They're not. So there needs to be a real living wage to attract nurses to come to public health.
So that's an interesting question. Can you tell me what attracted you to this field? Because you also have the ability to work at the bedside as well and to increase your salaries. So, what was the thing that attracted you to the field?
I was a school nurse. So I was making a lot less money than I am now. They definitely need to pay school nurses a lot more money because like the school district I was in, the elementary and the middle and high school were joined, and there was two of us. So if one of us is out, we covered the whole building, pre-K through 12th grade. There's not enough money in the world to protect my license. And that was a big reason for leaving school nursing, was especially if you don't have the backing of administration. That's another thing. So that was a big reason for getting out of school nursing.
So for you, it was jumping ship from one area of public health of nursing to another area, because it was complicated in doing the work that you were doing around school nursing. I should tell you that the thing that I learned about school nurses, the most important thing that school nurses, because when I was public health director, the school nurses worked for the health department. The most important thing that the school nurses could provide was ice, that it was just the friend to all, ice. And when
Ice
the
pack and
ice,
crackers.
oh yeah, there you go. The
Yeah.
important, the truly important things in life.
Yes.
So, what
Yeah.
about others of you? What attracted you to the field? Because I'm hearing that there are challenges once you get in the field. So, and maybe the pay may not be as high for some as if you were at bedside nursing, but all of you are doing this incredible work. So, what attracted you here?
So I'll be the first one to say that bedside nursing was never my calling. The closest I got was inpatient pediatric psych, and even then, that wasn't necessarily bedside. um, I primarily worked in outpatient pediatrics, so I was in pediatric offices all the time. Um, but I think during the pandemic, I really saw this gap in care. Well, if a child didn't have insurance, it was hard for them to get into a pediatrician's office, so then they couldn't start school. And in my head, I'm like, that's not fair. That's just not fair. Like, why can't they get their shots anywhere else? That's not fair. So that was one of the things that really drove me into public health and looking more into it. Um, and I was like, you know what? if I can just make like one little difference, then that's what I'm going to do. And I'm going to work in public health and see what I can do to try to bridge a gap in some way. And my community, while it's affluent, it's not immune to having children with no insurance that don't have access to care. And it's nice for me to have that kind of background in PD because before I came to my job, we didn't immunize a lot of pediatric patients. Like the nurses weren't comfortable, or, families just didn't know that we existed. So I think that's the other thing that I really love about working in public health is being like, this is what we can do. Like we're essentially superheroes. I'm just gonna say it. Like if we don't have the answer, we'll find someone who has the answer. If we don't have that available resource, we have that resource in our shared services. Someone has it. And if we could just be that one conduit, that's great. And if we can do it, that's awesome. So I think that's what really appealed to me and just makes bedside nursing even more unattractive to me.
I want to echo just one piece that you raised. You mentioned that you are in an affluent community, but that you have challenges there as well. And it becomes really important that we all remember that even in our affluent communities, there are many people who are silently suffering. And that there are challenges in their needs for being able to deal with them. I'm wondering still about others of you because we're talking about two things. One is what challenges you about the work that you're doing? But then, secondly, what attracted you to the work that you're doing as well? I've heard from a couple of you. I'm wondering if I can hear from a couple of more.
I actually left the bedside to come to public health, and one of the reasons that I did that was for a better work-life balance. I was really struggling personally with working every other weekend and working every other holiday, and my workplace was very stressful. And the opportunity for my current role came up, and that's how I landed here. And I feel like it's been a really great shift for me, away from the chaos. Like Jenny said, I'm just not built for that, it was very stressful, And so I feel like this role has just also allowed me to do work that I'm more passionate about. Um, and these public health things, I really care a lot about them, and I feel like it's important to care about the work that you do. So that's what brought me to public health.
So the interesting thing for me as I listen to this is that, there are many different things that will attract people to their work or that keep people in their work. And some of them have to do with the things that you feel and some of the things that you were given. So on the things that you're given are things like pay and some external kinds of things. But then there are those intrinsic things of let's make this an environment that actually works better for me. And I'm hearing a little bit of both of those as I hear about what attracts you to the field. I'm wondering one more, Kelly, what brought you into this work?
So, I actually was started my nursing career working in critical care, which was also unfortunately right at the beginning of the pandemic. And I think that experience shaped a lot of why I ended up now in public health. Constantly seeing people that had, whether it was COVID or some other really preventable morbidity and mortality, and thinking to myself, gosh, I wish someone would have talked to this person about their, diabetes care or their cardiac health or this vaccine before it got to this point. Knowing that now I would be kind of wasting my breath if I sat there and talked to them about it. And I think that's not only what drew me to come into public health, but honestly, no matter what the challenges are, will probably keep me in public health. We are in such a unique position to have this influence on the community that really, can change lives. Maybe we don't see it always on a daily basis, but looking into the future, we really do have the ability to help people in that way. And it's just very different from dealing with the burnout of, seeing people on their worst days dying from completely preventable illnesses.
Yeah, it's really interesting about what challenges and what brings people into the work. And it's interesting in listening to your broad understanding about yourselves. So what attracts you? What is it that you need? What is it that you, as Fiona said, work-life balance becomes really important. That working every other weekend is not the thing that you want to do. But also in understanding that things like pay becomes critically important as well. That we don't want to yes, it's good to feel good about what you do, but you also want to get compensated for what you do as well. And that there are some areas of nursing where the compensation is a little different than it is for some of our public health nurses and for some of our school health nurses. But it's so critically important that you do what you do. So we have a number of people who are in the audience, and we aren't going to use our polling questions, but I'm still interested in understanding a little bit about who you are. So, could you please put in the chat where you come from, which communities you represent, and also what your discipline is? Are you a nurse? Are you some other area of public health? Or are you retired? If you could just give me that information, it'll help us to understand a little bit more about who you are that here as well. And while they're doing that, I'm wondering, as first, I want to come back to this business about challenges. Are there some more challenges that we have that we've not heard? We heard about needing to prioritize because there's just a whole bunch of work that needs to get done. We've heard about the importance of having a workforce and having sufficient individuals who are going to be doing the work. We've heard about the problem of what happens when you do some of the work and there's burnout, and that there are costs to needing to actually do the kind of work in the way that you're doing. Are there some other challenges that you would say are there some other challenges?
Yes, if I can go, something that you may not think of as a challenge can be interpretation services. So we have to make a lot of phone calls through our work cells, but using like a language line translator. And it's very difficult to communicate with people that you can't call without a translator, and they may not answer the phone if they don't speak English. You don't know what language they speak. But if you don't have that first conversation where they say Spanish or Arabic or French or whatever, you don't know to call back with an interpreter, and you may miss a very important case investigation and think, okay, they're just not responding, they don't care, this is lost to follow-up. So there are some people that can fall through those cracks if you're not very careful and mindful about the communication process. And if you don't catch that, maybe they don't speak English and you have to figure out what is going on. And your town or city also has to have the service available for you to use.
And does your town have that particular service?
We have language line in the city, and I think it allows us up to, I want to say 24 languages. It's not everything, it's not a lot, but it gets us through most of our patient care. I haven't had an issue where I've needed a language that was not available to me.
Mm-hmm. Well,
And
what
you
about others of
use
you? Do
Google
you have
Translate.
language line capacities? Meg?
Well, the state actually provides language line capacity just for the contact tracing work. So we have not had much need for language interpretation beyond that. I wanted to bring up another challenge, and that's that you really can't take care of people's health if you're not thinking at a policy level about various social determinants of health. And those are things like housing and employment and food. If someone doesn't have transportation, doesn't have a job, doesn't have a roof over their head, they're not going to care about some of the preventative work that will support their health, that are the sorts of things we do. So I think in some ways, public health needs to include making sure that there's enough housing for people to rent, that there are transportation options, that we need to think about it at a policy level as well, not just of, how can we communicate about vaccines? It's another piece of the job that it is very important, advocating for some of these things at the legislative level as well. But being in touch with some of those policy issues, I think, is really important. super challenging. There's such a breadth of things we do already, but we can't ignore it.
Yeah, I'm actually glad that you raised that, and I want to comment on that and ask a question. But I see that we're getting responses from people in the chat about the work that you do, and there are a number of nurses who are in the field, so who are chiming in. So I want to invite you also. It not only to just tell us about what you're doing, but are there particular questions or things that you think that we have not talked about that you think that are critically important as you think about the incredible work that nurses do already? So please add that to the things that you're commenting to us on in chat. So this business about being involved in policy becomes critically important because you begin to see what's actually happening at a population level. And you begin to think about, so here's something we ought to do differently. So I'm wondering a couple of things. I'm wondering what policy things have you been involved in, number one? But if you may not have been involved in policy directly, what is it that you think that we ought to do? Because there may be somebody here from the State Department of Health, State Department of Public Health that's listening, and we want them to actually be able to attend to this. So either what's something that you've done on the policy front, or what are some things that you think that we should actually pay attention to as we're thinking about policy issues?
Well, I have more thoughts if nobody else does. One is food security. We need to make sure people can eat. And if the federal government is changing policy to make that harder, it's not going to support people's health. One of the things I work on at the policy level is making our communities here more age and dementia friendly. And that sometimes needs thinking about just the policies. If a municipality is going to make a park, are you thinking in a way that will include everyone, that someone who has mobility challenges? Are there enough benches for someone to sit and rest on the walking path? All kinds of things. The choices of carpeting in a public space can make a big difference for someone who has sight challenges. We lose our sense of color as we age, so it can really matter. And there are issues with people with dementia, with how they process their visual cues. So knowing about that as you're carpeting or repainting your public spaces is important. So, I'm working with our local aging services access point on the regional age and dementia friendly initiative. And that's been really fun and satisfying.
So it is. So I'm going to push you a little bit more, all of you. It's because I think this issue about thinking about policy is critically important. It's not always the area that nurses think about. So again, my question is, are there things that you've either been involved in, or differently, are there things that you think we really ought to somebody ought to do it? I don't know who, but somebody ought to do something about this. So that's another way of answering this question. Somebody ought to do this. What's the this?
I think one thing that we've been particularly struggling with in our area, and honestly, I'm sure in all of Massachusetts and probably all over the country, is shortages of primary care, especially when people either have mass health or they don't have health insurance. Not only is there such a shortage of primary cares that are accepting patients, but then people get on wait lists that are going to take them. It's going to take them like a year and a half to even be seen. And I don't know from, an organizational standpoint, when we look at some of our community partners, if, there's larger hospital systems or government entities or, that are thinking about these things and looking at their numbers and saying, hey, maybe this particular area needs another community clinic, right? And a place that we can actually send people to, because we spend so much time trying to send people to the same places and then we get the same response like, well, they don't qualify for mass health and we won't give anyone vaccines if they don't have this or they don't have that. And I found that particularly frustrating and challenging, especially when we're dealing with the communities that really genuinely need this the most.
Yeah, thank you, Kelly. The business about thinking about where people, the availability of primary care and where they get that care is critically important. What else? Somebody ought to do something about this.
I
In,
I
oh,
have I have beef with concierge PCP offices. They're popping up all over the place. And then I have residents that have chronic illnesses that need to be medically managed that lose their PCPs and they're like, I can't find one that accepts Medicare. I can't find one that's easily drivable. I can't find one that's within X region. I have so many residents that call and they're like, do you know a PCP accepting XYZ? I'm like, I'm not an insurance person. I'm so sorry. And then when I tell them to call their insurance, they're like, this person accepts it, but it's a 6 month wait and I need a refill. I'm like, that is so tough. So if somebody could put a cap on all these concierge openings or maybe paying primary care physicians a little bit more to give them more, you know, ability to stay in their practices, that would be wonderful because I feel so bad that I have this poor grandma that has uncontrollable diabetes and she can't get any of her medication now because her PCP went to concierge. And who has thousands of dollars to pay for concierge when they're on fixed income? I just think it's just so unjust, in my opinion.
Thank you. All right. Somebody should do something about this.
in my mind, the this with a capital T is just funding, like as like a whole thing, because public health is the long game, and we need people who are going to be able to advocate for continued funding for projects that we do and the public health work that we do. And we can't do it without funding. And I just feel like we need people who are going to be able to advocate for that, including us, as nurses.
Yeah. It becomes really important that you identify it and that you are identifying what needs and what could be done. One more. Somebody ought to do something about this.
Transportation.
Tell me some more. What does that mean?
So in Berkshire County, we have Berkshire Regional Transit Authority, and there was talks about cutting services to South County, where I live. And they decided, no, they're not going to cut fund. They weren't going to cut the routes, but we don't have Uber or Lyft where we're at. So I don't even think there really is taxi service. So that's a problem. Yeah, there needs
So
to
the
be,
availability of how people get around in the first place.
yep.
Yeah. And that's indeed one of those important aspects of what people need in order to be able to get the care that they need to live the lives that are healthy and safe and such like. The comments that are coming in the chat are really very interesting. And there are two that I wanted to call attention to. Someone in talking about what kinds of services were needed talked about the importance of having a referral pathway, having a formalized referral pathway so that you know where to actually deliver services. And this certainly addresses the one of the concerns that Jenny addressed. And the other was from someone who was talking about why that individual did public health nursing as opposed to bedside nursing, and said they just get bored. And that public health nursing allows for a lot more flexibility, and I think it does, given what I am hearing from all of you. As we come up on the to the close of our conversation, I'm wondering what keeps you motivated in the field. You've told me about all the things you've done. You've told me about some of the things that are challenging in the work, but what keeps you motivated and where is your hope as you think about this particular field?
I can go. I I just enjoy, like Fiona said, like a lot of our work tends to be behind the scenes, but it's nice to see when our work actually comes to fruition. And we're not ones to really take credit for our work. So it's nice when people are like, I know you were behind this, like, good job. It's nice when your colleagues and maybe your own residents know that you did something for them, but they just didn't know it. Um, So it's nice to be recognized in that sense and having a good support system, like fellow colleagues here, and especially if you're in an SSA, it's nice to have people that have your back and can understand your struggles and can also help you with your work. So I think that's one of the big things that keeps me in this job is just seeing my work come to life and then just having really supportive colleagues.
Thank you, Jenny. I'm going to ask each of you that same question as well. Who'll go next?
I
I
agree
will.
with, oh, sorry, Meg.
Sorry, Fiona. Go ahead.
I agree with Jenny. I think that seeing the effects of your work definitely is a good feeling. And also knowing that the work that just like knowing the work you do is important and that somebody has to do it. Somebody has to keep working behind the scenes and especially with everything going on currently, it's needed, I feel now more than ever. And so I feel like we're just out here fighting the good fight, and that's what, I feel like that's what keeps me going.
Thank you. Meg.
Yeah, I was going to say something similar. It's fun too. I really love doing home visits. I love building relationships with people wherever I go. I love my colleagues. It's very satisfying, and yeah, it's good work. It's good work, and you can feel good about it at the end of the day.
Amelia.
I really appreciate the diversity of the work because no 2 days are alike. I like that's my vibe. Like I can't be bored, and this is not boring by any stretch. And I also run the Worcester Regional MRC unit. So I have a lot of different things going on, and I like it like that. Um, I have to multitask, but that's where I succeed at that level. Not doing just one thing at a time, but having a few things going on. I don't know. It's very satisfying to me.
Thank you very much. Kelly.
There's so many reasons. It's hard to pick, but I do just want to highlight how incredibly powerful the public health team, especially in Massachusetts, is. No matter what is going on, it could be the most stressful communicable disease case you have all year. There's more than 10 people that are going to answer the phone if you call them, give you advice, and also lift you up and tell you this is good work that you're doing. And I think every nursing profession lends itself to that, but public health particularly, we see that a lot. So you really do build this beautiful network of people that all are doing work to help the community. And that's a really good feeling.
Thank you. Shuang.
Yes, a lot of things that makes me feel my work worth it. For example, like if make sure there's no outbreak in my community, that makes me feel worth it when I see people around the community study, work, living here happy. And also sometimes we might help a little bit of somebody else's life, which also makes me feel like my work worth it. It's like a little bit of everything that keeps my motivation in the job.
Thank you very much. Jill.
So there's going to be some workforce training coming up for public health nurses I'm excited to see what they have in store for us and to be able to um, put that into action and, meeting the needs of our community.
I appreciate what you've all done. I've worked around nurses for a long time and have a number of nurses in my own family and appreciate the challenges as well as the incredibly wonderful work they're doing. So I want to thank you for everything that you've done in the past, everything that you're currently doing right now, and perhaps most importantly, I want to thank you for everything that you will be doing in the future. So to each one of you, thank you for being part of this conversation. Amelia, Meg, Fiona, Jenny, Kelly, Schwung, and Jill. This is exactly the conversation that we needed to hear of what's going on with our nurses right now. Thank you so much for participating. And for those of you in the audience, thank you so much for being part of this. Al, I'm going to turn it back over to you.
What a magnificent panel and discussion this has been. It's a thank you all for sharing your experience, and the broadness of this discussion was really amazing. And I want to point out one thing: for 24 straight years, the Gallup poll of what professions are most trusted, the nurses have been number one for 24 consecutive years. So that's a great power, and a great power to bring to public health in your communities. So thank you for participating in this. Thank you for your work in public health nursing. Thank you, Harold, for moderating. I'm sorry about the technical issues with the. So I remember to record, and I recorded the chat, so we have that, and the the I can't get myself back in the room, but you don't need to see me. Uh, so thank you all. This will be posted on our website, so it'll be available. And I would recommend people referring people to the recording, because I think it's been an incredible summary of where we are in public health nursing now, and very inspirational. And especially for nursing students. I hope anybody who has contact with nursing students will send them to the recording. And this recording will become part of the collection of the museum. So someday people may come to this recording to find out what was going on. And I think they're going to get such an incredibly accurate picture of public health nursing in Massachusetts in 2026. So thank you, and happy Public Health Week.
Thank you. Thank you, everybody.